So diuretics basically excrete the sodium and fluid and reduce the blood pressure. So different kind of diuretics we use as an antihypertensive medication. What are the classification of diuretics? So this on loop diuretics, osmotic diabetics, potassium sparing, and thiazide diuretics. The loop diuretics more commonly we use furosemide or bumetanide. Osmotic diuretics basically mannitol. And potassium retention, or we call potassium sparing diuretics, are spironolactone, thiazide diuretics. Most commonly we use hydrochlorothiazide. Also, other diuretics we use, it is called acetazolamide or carbonic anhydrase inhibitor. Here, some of the name of thiazide diuretics or thiazide-like diuretics, like chlorothiazide or chlorthalidone hydrochlorothiazide, most commonly used. This is the picture of renal tubules. This is glomerulus, and this one is called Bowman's capsule. And this first part, the convoluted tubes, this is the loop of Henle, right? And this is the distal convoluted tube. So name proximal convoluted tube, this portion. It is inside the cortex, but in medulla, we can get loop of Henle. This area is called thin descending loop of Henle, and this area is loop of Henle, and this area is called thin ascending loop of Henle. This is distal convoluted tubes, and this area is called collecting tubules. So different drugs like carbonic anhydrase inhibitor works in this proximal convoluted tubes. Example is acetazolamide. And osmotic diuretics also work in this proximal convoluted tubes like mannitol. And loop diuretics work in these areas. Loop of Henle, loop diuretics, like frusemide and bumetanide work, right? And also the thiazide diuretics also work in distal convoluted tubes. Example, chlorothiazide or hydrochlorothiazide. And other medication like potassium sparing, spironolactone, or aldosterone antagonist work in the collecting tubules. Spironolactone, it is potassium sparing, or triamiterone, right? It is called water pill. So, thiazide diuretics increase the sodium and water excretion by inhibiting sodium rejection in the distal tubules of the kidney, used for hypertension and peripheral edema, and not effective for immediate diuresis, used in the client with normal renal function. Thiazide diuretics should be used with some caution in the client who taking lithium, because lithium toxicity can occur, and also in the client who taking digoxin, corticosteroid, or hypoglycemic medication. So thiazide diuretics basically act in distal tubules, this here, and used for chronic hypertension. Thiazide diuretics basically used for chronic hypertension. They slow acting diuretics or increase the toxicity in heart medication like quinidine and digoxin. And also thiazide decrease the effectiveness of anti-diabetic medication. Important to know about the thiazide. What are the thiazide diuretics side effect and contraindication? Thiazide diuretics, particularly, they cause potassium depleting, means potassium level go down, or blood pressure go down, or sodium level go down, but glucose level go up. So common side effect, they can cause hypercalcemia, hyperglycemia, and hyperuricemia, but they can cause hypokalemia, hyponatremia, hypovolemia, hypotension, right? They also can cause rash, photosensitivity, and dehydration. So what are the easy way to remember? So hypercalcemia, hyperglycemia, hyperuricemia, all is increase, right? If my patient have a diabetic, so they have a chance to increase blood sugar level. So we educate our patient to adjust the insulin or calcium concentration increase. If patient have a gout and uric acid level go up, so it is increase the concentration. But other side effect, they can cause reduced potassium, reduce sodium, and volume go down because diuresis is too much pee. When volume go down, definitely blood pressure go down, and also dehydration because too much pee. All of them is go down. And another one, they can cause photosensitivities. Important to know. So if thiazide diuretics have this kind of side effect, it is important to nursing implication, educate them. It is important to monitor BUN. It is important to monitor electrolyte, particularly potassium and glucose level. Monitor intake and output, and educate your patient, increase potassium in the diet. What next? Intervention, monitor vital sign, monitor weight, monitor urine output, monitor electrolyte, glucose, calcium, blood urea nitrogen, creatinine, uric acid level. Also check the peripheral extremity for edema, monitor for sign of digoxin and lithium toxicity, and instruct the client to take medication in the morning to avoid nocturia and sleep interrupt. So diuretics, when you take, you have to go again and again for the pee. So if you take at the morning all day, increase the frequency of urination, so your sleep will not be disturbed. So you can avoid the nocturia, so you can avoid sleep interruption. Instruct the client how to record the blood pressure. Also, instruct the client to eat food high in potassium. Instruct the client how to take potassium supplement if prescribed. Instruct the client to take medication with food to avoid gastrointestinal upset. Instruct the client to change position slowly to prevent orthostatic hypotension. Instruct the client to use sunscreen when in direct sunlight because of increase the photosensitivities. Instruct the client with diabetic mellitus or to have the blood glucose level checked periodically. Now, let me explain loop diuretics. So, loop diuretics inhibits sodium and chloride reabsorption from loop of Henle and distal convoluted tubes. And loop diuretics have a little effect on blood glucose level. However, they cause depletion of water and electrolyte and increase the uric acid level. So if your patient have a gout, it will increase, and also excretion of calcium. The common loop diuretics are furosemide and bumetanide, or ethacrynic acid, torsemide. Right? So if you go in this picture here, the loop diuretics act most effective and fast acting, right? So the loop diuretics work this area, and they can be given orally or IV. And when our patient take loop diuretics, we have to watch for decreased potassium level, or may cause the loop diuretics may cause ototoxicity. So the chance will increase when given with an aminoglycoside. And loop diuretics used for acute edema because of pulmonary problem or chronic heart failure, congestive heart failure. So loop diuretics are more potent than thiazide diuretics and causing rapid diuresis. So if we need most effective or fast acting, we use furosemide, we use bumetanide. And loop diuretics are most potent, but thus decreasing vascular fluid volume, cardiac output, and blood pressure. Used for hypertension or pulmonary edema or edema associated with heart failure. So I said we use it for acute edema because of pulmonary cause or heart cause. And use the loop diuretics with precursor in the client taking digoxin or lithium, and in the client taking aminoglycoside, anticoagulant, corticosteroid, also antifungal, particularly amphotericin B. And now go for the side effect and adverse effect of loop diuretics. So the common side effect, they can cause hypotension, or they can cause hypokalemia, they can cause hyponatremia, as like as thiazide diuretics. But they particularly, they can cause trinitas, constipation, or increase the BUN level, photosensitivity, as like as thiazide diuretics or hyperglycemia, right? So easy way to remember, I said the loop diuretics can cause hypokalemia, hyponatremia, hypocalcemia, hypomagnesemia, and thrombocytopenia. So all is go down or reduce. So if you compare contrast with thiazide diuretics, they also cause hypotension, hypokalemia, hyponatremia, right? But they cause hyperglycemia, and loop diuretics also cause hyperuricemia and hyperglycemia. They can cause also hypotension. Thiazide diuretics also cause hypotension. They can cause rash, ototoxicity, and deafness or tinnitus. Or loop diuretics can cause thyroid thiamine deficiency. Thiamine means vitamin B1 deficiency. Or they can cause dehydration. So when too much pee, blood pressure go down and dehydration will be more common. So if my patient have a high diabetic, it is important to tell them to adjust blood glucose level, right? Because they can change the blood sugar, particularly hyperglycemia. What next? Loop diuretics intervention. Monitor electrolyte, calcium, magnesium, BUN, creatinine, and uric acid level. Admin IV furosemide or slow over 1 or 2 minutes before hearing loss, or hearing loss can occur if injured rapidly. Now, potassium sparing diuretics. Most common is spironolactone. Potassium retaining diuretics act on the distal tubules to promote the sodium and water excretion and potassium retention. So loop diuretics and thiazide diuretics, potassium depleting, but spironolactone, they potassium sparing. So increase the potassium level. So used for edema and hypertension to increase the urine output and treat the fluid retention and overload associated with heart failure or ascites resulting from cirrhosis or nephrotic syndrome, and also diuretics induce hypokalemia. Potassium retention diuretics are contraindicated in severe kidney problem or hepatic disease or severe hyperkalemia. Potassium retaining diuretics should be used with caution in the client with diabetic mellitus or taking antihypertensive or lithium, or also taking angiotensin converting enzyme inhibitors or potassium supplement because hyperkalemia can result. So if we go back in this picture here, this area is called collecting tubules, and potassium sparing work on this site. So potassium sparing used orally and not as powerful as loop diuretics. And when patient takes spironolactone, it is important to watch for an increased potassium level and do not give to the patient with diabetic mellitus. And it is the best diuretics for hyperaldosteronism, and they may cause agranulocytosis. So potassium sparing diuretics may cause agranulocytosis. So here, name or list of potassium diuretics is said. The drug's name, amyochloride hydrochloride or spironolactone or spironolactone hydrochloride, triamiterine. The primary concern with administering potassium retaining diuretics is hyperkalemia. So, side and adverse effect, patient tends to develop hyperkalemia, GI upset like nausea, vomiting, diarrhea, rash, dizziness, weakness, headache, dry mouth, photosensitivity, anemia, and thrombocytopenia. So, loop diuretics, thiazide diuretics, potassium sparing diuretics, all of them can cause photosensitivities. And potassium sparing or retaining diuretics can cause hyperkalemia, or they can cause constipation, menstrual irregularities in case of female, muscle cramping. So it is important to implication for monitor electrolyte because it tends to increase potassium level. So educate your patient, decrease potassium in food, in diet. So monitor vital sign, monitor urine output, monitor for sign and symptom of hyperkalemia such as nausea, diarrhea, or abdominal cramps, tachycardia, followed by bradycardia. If you see in EKG, we see tall and peaked T wave on electrocardiogram. Monitor for potassium level. If it is greater than 5.0, it indicates hyperkalemia. Also instruct the client to avoid food high in potassium. Opposite of loop diuretics or thiazide diuretics. Instruct the client to avoid exposure to direct sunlight. Instruct the client to monitor for the sign of hyperkalemia, and instruct the client to take medication with or after meal to reduce the gastrointestinal upset. I'm going to go back in this picture to tell something about osmotic diuretics. So number 2, osmotic diuretics. Example of osmotic diuretics are mannitol. So mannitol or osmotic diuretics used to get rid of water instead of sodium. And it is the best for increased intracranial pressure. And another medication is called number 1 here, carbonic anhydrase inhibitor. It is, example is acetazolamide. So acetazolamide, I mean, this one is work on the proximal convoluted and this area. They blocks the carbonic anhydrase in proximal tubules, this area, and not used much as a diuretics. Better for open angle glaucoma. So if anybody have an open angle glaucoma, we use acetazolamide, and acetazolamide is a carbonic anhydrase inhibitor. So why we use for open angle glaucoma? Particularly when you are trying to get the ocular pressure down, and also increase the loss of bicarbonate can lead to metabolic acidosis because they work on this channel.